like this here. Here is better and also moving posterior anteriorly now. You can see that this part is still part of the occipital bone. This is part of the occipital bone, which they call the squamous part of the occipital bone. You can see this most superior ridge or line is known as the superior nuchal line. Superior nuchal line. While this other one is known as the inferior nuchal line. Is that okay? You can see running from here across that the center. The whole of this is known as what? The external occipital crest, which will run to come and terminate at the posterior part of the foramen magnum. This is the largest foramen in the skull, which will convey about 10 different structures as time goes on. We'll come to see that at the anterior lateral part of the foramen magnum is a condyle bone. This bone is known as the occipital condyles. The occipital condyles will articulate with the first cervical bone, which is the atlas, to form the atlanto-occipital joint. The atlanto-occipital joint actually allows nodding movement of the head like this. A nodding movement of the head like this. Yes, nodding and saying that this particular sweet you are taking is sweet. Nodding movement. Penetrating or passing through these condyles from the inside outside or from the outside inside is the hypoglossal canal. The hypoglossal canal there, which you can see, I don't know whether we'll be able to pass the broom.
No,
all right. The hypoglossal cranial 12. Cranial 12. The cranial 12. Now, anterior medial to these two condyles is a bony mass. This bony mass is known as the basic occiput. Basic occiput. At the center of it is a tubercle, and this tubercle is known as the pharyngeal tubercle. Pharyngeal tubercle. Is that okay? This is known as the pharyngeal tubercle. All these skull bones, they are not as fine now. Now this one is not even showing it. So go on with this now. We'll come to see that just lateral to this particular basic occiput on both sides is the strongest bone of the skull, known as the petrous part of the temporal bone. This is the petrous part of the temporal bone on both sides. And we can see on this inferior aspect of it is a big foramen. This foramen is known as the carotid what? Canal. Carotid canal. This canal actually conveys the internal carotid artery, which is a major arterial supply to the structures within the brain. Is that okay? That is this other one here. So take note of that. Now we'll come to see here, just by the side anterior aspect of this particular petrous part of temporal bone, is another foramen here. This foramen is known as foramen lacerium. Foramen lacerium. This foramen lacerium in the living is being covered by cartilage. It's being covered by cartilage. However, at the anterior aspect of it, that is where the word internal carotid artery actually appears in the skull. Having entered here, it will appear at that particular spot. Is that okay? So this is it. So the cartilage will be penetrated by structures like the lymph vessels and a emissary vein. So having said that, anterior to this particular structure, here you have just in front of it the choanae. The choanae. The choanae are the gateway to the nasal cavity posteriorly. Choanae. They are the gateways to the nasal cavities what? Posteriorly. Just on this upper part, roofing this part posteriorly, we will see part a bony structure. This bony structure which you are seeing contributes to what? The palatine. Is part of the palatine bone. This is the horizontal plate of palatine. Its posterior extension at the center, which is this also, is known as the posterior nasal spine. This is the posterior nasal spine. Since there's a posterior nasal spine, there will be an anterior nasal spine. So this anterior posterior nasal spine. So if you check very well, posterior nasal spine here, you'll see it is still on this bone, both by the sides. At the sides of it, you see the greater and lesser palatine foramen. Greater and lesser palatine foramina. This convey those greater and lesser palatine vessels. Let's see whether this one is showing better. Which one is showing better? This other one also. So this now. So in front of this particular structure, because this one is for the palatine also, for example, you have what we call the palatine process of the maxilla. This is the palatine process of what? Maxilla. Palatine process of maxilla. You can see that they are meeting at the midline. Anterior to this midline structure is another foramen known as the incisive fossa, which will convey like the sinopalatine nerve. At the end, at the sinopalatine nerve. Now we'll come to see that bounding the whole of this structure on both sides, you can see them bounding on it like in the form of a U-shaped structure. This particular part here, you talk about the alveolar process. So this is the alveolar process. On each summit here, you have the alveolar sockets. These are the alveolar sockets. Alveolar sockets accommodate or receive the different dentation. So these are the alveolar sockets that receive the what? Different dentations. Is that okay? So these ones, I think we were having a clearer scoreboard, we would have gone to appreciate this some other foramen. However, we'll come to see that just lateral to this structure on both sides, you can see this big opening. This is known as the foramen ovale, behind which lies the foramen spinosum. All this will appreciate it when we look at the cranial fossae. These are the important things you need to know with respect to the inferior part of this particular